Today we're releasing the 4th annual state report card on children's physical activity and health for the state of Louisiana. The primary goal of the report card is to assess the level of physical activity and its correlates, its barriers, and some of the facilitators to physical activity for the children and youth in Louisiana. For the last 3 years, you may recall that we've issued a grade, and the grade has been a grade of D for 3 consecutive years. This is not unexpected, given that the health parameters that we're tracking, things like obesity, physical fitness, these things take a long time to change. We don't wake up one morning and have a huge change when you're talking about things related to public health. So this year, given the lack of new data that's available for the state of Louisiana, we've decided to forego assigning an actual grade, and we were focusing on designing health targets for improvement for the year 2020. And you can see that reflected in the title of this year's report card. Another thing we've done is produce key evidence-based recommendations that we can all use to move forward to try to hit these targets by 2020. So this year's report card, like other years, was developed by a report card advisory committee made up of stakeholders and researchers from several institutions across the state. Their task was to design the overall report card and to develop these health indicators as well as the goals for 2020. And this year we took a different approach. Usually we worked on this and the committee worked on it, and we released it in September. This year we released a draft report card in August for public comment, and after receiving comments from the public, then we've produced the final draft, which we're releasing here today. So let us now turn to this year's report card. I should just let you know that there are 2 versions of the report card. We have a short kind of executive summary version, and we have a longer version which contains all the data behind the recommendations and all the references that we used. So this 2011 report card was modeled off of Healthy People 2020. Now, Healthy People 2020 is the federal initiative which calls for nationwide improvements in health against current benchmarks. However, let me emphasize that the data and the targets for Louisiana are specific to Louisiana's children and youth. And in fact, we took a more aggressive approach at setting public health targets, given the historic poor health rankings in the state. For example, Healthy People 2020 generally call for a 10% improvement in most of the indicators. In our case for Louisiana, we've chosen a 20% improvement for physical traits such as obesity, physical fitness, and a 40% improvement for things such as physical activity and health behaviors. So let me just focus on just a couple of our recommendations and our targets. We would like to decrease the proportion of children in the state who are obese by 20%. Currently, 29% of children and youth in Louisiana are obese. And this does not include overweight children. When you combine overweight and obese, you get 48% of our state's children overweight and obese. So we would like to lower this from 29% to at least 23% by the year 2020. Secondly, we would like to increase the proportion of kids who are meeting the federal guidelines for physical activity. Currently, 23% of kids in Louisiana are meeting these guidelines, and so we'd like to increase this to at least 32% between now and then. The third thing we'd like to do is decrease the number of children and adolescents who are exceeding the recommendations for television viewing. Right now, 40% of our kids are exceeding these recommendations, and we would like to lower this to 24%. Finally, the last one I'd like to highlight is fruit and vegetable consumption in the diet. Currently, 9.7% of adolescents in high school eat 3 or more servings of vegetables. So 9.7% are eating enough vegetables. Only 3.5% are eating 4 or more servings of fruit. So you think that a 40% increase is a long way to go, but actually a 40% increase takes us to 13.6% for vegetables and 5%. Only 5% of our kids eating sufficient fruit. That's our target. I know it's low, It's a step in the right direction. So a major feature, as I mentioned this year, are evidence-based recommendations. And that, I think, is the highlight of this year's report card. For every indicator, we've outlined specific recommendations that we can do as parents, teachers, administrators, policymakers, and voters. I mean, we all vote. We should have this on our agenda to improve the health of our children. And this report this year is full of these recommendations. So we're very happy this year to release that, and we look forward to seeing how it's used by stakeholders across the state who want to see action and to take action for our children. So in closing, the report card still is an advocacy tool for educating the public and shining the light on the poor health of our children and recommending ways forward. So we would like to thank all of our partners and sponsors on this project, which include representatives from across the state, both from an institutional perspective and geographically. So especially the Louisiana Obesity Council, Blue Cross and Blue Shield of Louisiana Foundation, Our Lady of the Lake, the Louisiana Public Facilities Authority, and the local Coca-Cola. So at this point, I'd like to introduce Bruce Greenstein, Secretary for the Louisiana Department of Health and Hospitals. He's going to tell us a little bit about DHH's plan to address this problem. Bruce.
First, let me bring down the stage if I could. Thank you, Peter, very much for having me here. You know, before I start with some traditional statistic-filled talking points, I just want to say that I'd imagine that a day like today is when a prestigious research institution reveals the true statistics that reflects our society, and then public policymakers come up to make excuses in the most articulate way to say why we're almost last or why we'll never get to the top. But today's discussion is going to be a little bit different, and I think if you just look at those who are in the queue to speak today, you're going to realize this is a much different approach to a problem that's age-old. But first, I'm going to start with a big theme. And for everyone that works with me or heard me give speeches before, my theme is really to own your own health. Take out the middleman of the excuses. All of us own our own health. And we have a great deal of impact on our families, in our communities, in our workplace, in our congregation. And when I listen to Peter talk about moving public health statistics, that's something that you can't do overnight. And it's true. We have a long way to go. But what can be started overnight is all of us. Wake up tomorrow with a commitment that you're going to eat better and you're going to exercise every day. That's something you can absolutely do overnight. And you all own your own health, so it's up to you if you want to do it or not. And influence your family, your workplace, your congregation, and your communities as well. But first I want to talk about another public health threat that we all have a great deal that we can contribute to beating as well. And it's the flu. Nearly 100% preventable, the flu. And you could avoid it by taking some simple steps. The simplest and most straightforward is to get your flu shot, which is available today. The CDC recommends that everyone older than 6 months gets a flu shot. So it's flu season, flu shots are available. I hope everyone gets one. And it's available this year in both a shot and nasal mist, so if you're afraid of getting a shot, you have no excuse. It's available all over the place, at your doctor's office, corner pharmacy, parish health unit, at little or no cost, depending on your insurance coverage or financial means. So really, there's no excuse at all for not getting your flu shot. And remember, Louisiana, spread the word, not the flu. It's time to get your flu shot. I'll offer a challenge in this as well. So we might not score at the top in our various public health measures, which we're about to discuss in more detail, but we're pretty close to the national average for kids getting their flu shot. Last year, for kids between 6 months old and 17 years old, we were at 48%. The national average is 51%. Let me challenge everyone here, whether you fall in that, a lot of young people here, but I don't know if anyone's under 17. If you're a parent, Bring your kids in. Have the flu shot done. Let's beat the national average. If we can get above 51%, that will beat the national average and fulfill a great challenge. And we should be on our way to 100%. We shouldn't stop at just the national average. Okay, now to the topic of the day, which is obesity. First of all, let me thank Pennington Biomedical Research Center for the opportunity to be here today and for the work, most importantly, that they've been doing and continue to do. Their commitment to diabetes and obesity research is outstanding. And while it's in a quiet part of town and maybe not everybody drives by this institution, it has an absolute world-class reputation. It is a gem in the LSU system, and it really is a privilege to be a part of this institution right here in our state. Let me also thank those that are sponsors of the report card as well. Making the report card available addresses one of the problems that often leads to excuse, which is we don't have good baseline data, we don't know what we're working from, and some reason that would somehow stop organizations, people, schools from going out and beating what they know is a bad problem. We have some of the state-of-the-art data and research happening right here on our own problem. We all know that this is a significant issue for Louisiana families, but it can't be just about more statistics. We all know the numbers. Louisiana is ranked second highest in the nation in obesity, and that's according to the 2009 CDC report. And we know it's getting worse rapidly. Already, Louisiana's obesity rate has nearly doubled since 1999, when it was 17.7%. And I remember in the 90s, we were all, as public health people, looking at the data saying, this is an epidemic, this is unsustainable, it's too high. At 17.7, we could only wish we were at 17.7 today. We're not. 1/3 of our state, 33.9%, is considered obese. That's crazy. And when you include the number of people who are overweight, as Peter mentioned before, it's nearly 2/3. 65% of Louisiana adults are overweight and obese. 65%. That doesn't leave a whole lot of other people that are not. The saddest statistic, though, are the ones that involve our children. During the 2008 and 9 school year, height and weight was taken on approximately 13,000 school children between the ages of 2 and 19 that were seen in our school-based health centers. It revealed that 48% of all children being seen in our schools are overweight and obese. So it's about half. Think about it. The carefree years of childhood, where exercising and playing is what should take a great part of the time not in school and sleep, it's not happening that way. And half of our kids are overweight and obese in our schools. This has to be not about making more excuses or talking about that too few schools offer PE or there's too many channels on cable TV to take our attention away from other things. This has to be about taking action. And I'm not just talking about Pennington taking action or DHH taking action or LSU taking action. I'm talking about every Louisiana parent taking action today in favor of healthier choices for themselves or for children. It's time that we all own our own health for ourselves, for our families, and for our communities, and for our state. Think about this. How many parents out there would allow a 6-year-old to sit in front of them and smoke a cigarette or to drink a beer? None. That better be the answer. None. Yet how many watch their children, and in some cases even encourage them, to gorge on fried and fatty foods, to drink sugar-laden sodas with no balance of fruits and vegetables, or whole grains, or lean proteins that our children need to grow and to be strong? We are creating a generation whose poor eating habits and lack of exercise will doom them to a lifetime of serious illness. Obesity is a serious threat that has been linked to gallstones, liver problems, heart disease, congestive heart failure, stroke, high cholesterol and blood pressure, diabetes, and even some form of cancers. We're seeing it in very young children now, high cholesterol, diabetes, and heart disease. And I'm sure many of us here saw last week that a panel of national experts released new guidelines that all U.S. children should now have their cholesterol checked between the ages of 9 and 11. One generation ago, that would be absolutely unheard of. except for some maybe rare cases where it's hereditary. And now for our kids between 9 and 11, checking for high cholesterol. These were once considered the diseases of the elderly, but now we are seeing them increasingly among children. We cannot accept it anymore. Today, I speak out to every parent. It's time to take charge. Own your own health for your family. Change out the apples for the fries for, I just had a Rick Perry moment there. Change out the apples instead of fries. Take the stairs instead of the elevator. We know what we can do. Obesity is a complex public health problem, but the reality, the solutions are quite simple. Eat healthier, exercise more, every day. That's really all you have to do to start that journey. Tomorrow starts the new measures in public health. It'll take a little while for the numbers population-wise to catch up, but if everyone makes that commitment to turn off the TV, to have more fruits and vegetables, to limit the portion size, we can make a difference. And we won't be asking Louisiana families to do this alone. They are not the only ones who need time to take the steps necessary to create an environment for healthier living. Many of our partners here today are engaged in several initiatives to help us move the needle, and DHH is working to help coordinate several of these across different partners. I'd like to talk about a few of them. First is the Healthy Foods in Hospitals initiative. DHH is establishing healthy food guidelines for all of its facilities, and actually there's an RFP for all of DHH facilities that's on the street today, and it is likely to be the healthiest food service RFP in the country, which, by the way, was Pennington approved. And now we're working with LSU Health Sciences Center and the Louisiana Hospital Association to work on similar goals in every hospital in Louisiana. The Healthy Foods in Hospital initiatives also includes a partnership with Nicholls State University to develop a culinary arts and nutrition program for their students focused on cooking in healthcare facilities like hospitals and nursing homes. Next is the Worksite Wellness. Louisiana Business Group on Health, in conjunction with DHH and several other partners, is releasing a Worksite Wellness Toolkit available to all Louisiana businesses willing to step up and help their employees enjoy healthier choices. Businesses have much to gain in saved healthcare costs and increased worker productivity when their employees are living healthier. And we will start this at DHH with our own employees. The next is Living Well Louisiana. In 2012, in January, DHH will launch a new web-based tool called Living Well in Louisiana, where residents can track their exercise against individualized goals, challenge themselves and others, and get important information on eating healthier and exercising. And that's available without cost to everyone through the website. This will be a great tool for families and parents who want to work together and challenge one another to make better health choices every day. And finally, the transformation of Louisiana Medicaid through Bayou Health implementation. DHH will be working with Bayou Health plans to establish quality standards and goals for members of their health plans. Since more than 80% of the members of Bayou Health will be children that are covered by Medicaid and LACHIP, we know that we can make a difference through the coordination of health care at early stages. You will see many of our plans aren't just for children. This isn't a child or teen problem only. This is a family problem. We need to start with adults. Healthy parents raise healthy children, and that's what we aim to do with these first steps. And this is just the start. Working with the many partners who have joined us today and others throughout the state, we must stop accepting the status quo and the excuses. We will only turn the tide one good decision at a time. Now is the time. Make the healthier choice today. Own your own health. Work with your families, your communities, your congregations, and we could all live in a healthier Louisiana very soon. Thank you.
Every year we've given a grade on childhood health, and every year it's been a D. So this year we decided to forego giving a grade, and we're setting public health targets for 2020. Targets that we're hoping our children and our state can reach by 2020.
And why is this important to Louisiana?
Well, I think it's important to have public health goals, something to shoot for, and then we can develop strategies to attain those goals. If you just have very broad goals to say, oh, we're going to end obesity, that's very hard to get there. I think we need very specific goals in mind.
And what would you like people across the state of Louisiana to know?
Well, I think the first thing is that this report card is available. It's evidence-based, meaning it's all based on science, and our recommendations are scientific. And it's available at www.louisianareportcard.org. And they're freely available, and we want everyone in the state of Louisiana to take a look at this.
Today we're at Pennington Biomedical Research Center. They've released their obesity guidelines and baseline data. They provide a very good backdrop for us to pick our goals and see where we want to go as a state. We know Louisiana is number 2 in the nation for obesity. We have a poor track record for 65% of our adults being overweight and obese. We have to make a change starting today. DHH today announced several programs that will make it easier for people to be part of a program, to eat healthier, to exercise, to be healthier in their workplace. As a state, we must set our objective to being healthier and having lower rates of obesity and overweight.
What would you like people across Louisiana to know?
Here's my simple message. We all own our own health. Don't look for an elaborate government program, or don't think that it's necessary to enroll in an expensive health club. We know we can eat better. Every day we need to make choices. Choose fruit or a salad over fried foods. Choose a baked or grilled instead of fried. Choose the stairs instead of the elevator. Simple things like that. With our kids, we know. Turn off the television. Exercise outside. Make better choices for eating for our children. These are steps that we can take starting today, that we own those choices, and we must take them if we want to have a healthier Louisiana.
Tell us a little bit about what Nichols is doing at their school in their curriculum.
Well, Nichols has the John Falls Culinary Institute, which is internationally renowned, and we also have the dietetics program, which is accredited by the American Dietetics Association. And those two programs are collaborating on a number of initiatives, including the creation of a food biology course that all university students can take, not just majors in culinary or dietetics. We're also creating a certificate program in healthy cooking techniques for hospital cooks and school cooks and industrial cooks. And the Culinary Institute wants to create lean cuisine competitions where they can invite international chefs over to Thibodaux, Louisiana to make the most delicious and nutritious meals possible.
Why is it important for Our Lady of the Lake to help sponsor this report card?
Well, one of the pieces of Our Lady of the Lake that has forever been a commitment in the mission is to children. And let's face it, we're as healthy as our children are. And the idea a couple of years ago was actually that we would get involved with Pennington to help promote, preventing obesity, healthy endocrine lifestyle, things like that, several years ago. And so we have actually endowed a chair in honor of one of our founding sisters, Sister Adana Corcoran, and it is a chair to recruit expertise to Baton Rouge and Pennington that would be leading experts in not just pediatric endocrinology, but pediatric obesity. So the commitment was made a few years ago to actually bring in more expertise to help us develop the tools and do the research that we need for these kids. But it just makes, as a pediatrician, it just makes such sense to me that the healthier our kids are, the healthier we all will be, because it's hard to not do something for your kids and not consequently do it for yourself as well. Just as it's really hard for kids to develop good habits, it's really hard for us to break bad habits. So if we do it together from the beginning and we say, well, okay, this week I'm going to make the choice to have a better or a healthier breakfast, and we really get the healthier breakfast going, instead of saying, okay, I'm cutting out all fats, all this, I'm doing everything all of a sudden. If we could take it week by week or 2 weeks at a time to make one change, then not only will those meals or those choices like exercise and just going outside with our kids, it'll be better for our kids, but it'll be better for ourselves. And slowly over time, it won't seem as painful. Because I think whenever we talk about obesity, no matter what age you are, we think, oh, that's painful. I don't want to give up my fried this or my, pudding and different things. So I think that would be the one thing is make the decision and make the choice and make it just steps at a time. And sooner or later you look back and you've made miles worth of journey instead of thinking, I've still got to try to get started.